Welcome to week 6 of learning the language of medications. This week, we're going to be talking about the second half of our neurology meds and our respiratory meds. So, seizures, sleep, and breathing. I am Ellen Jones. I am an associate professor of pharmacy practice and board certified ambulatory care pharmacist. So, let's get into it. We think about seizure medications and inhalers being completely unrelated, but they actually have a little bit in common. They're used to control abnormal body activity. Some of it is related to excessive electrical signaling in the brain, which is the neurology piece, and then others reduce inflammation and improve airflow. These are our objectives for this week. We're going to recognize the anticonvulsant medication classes, identify common sleep meds, differentiate the major inhaler classes, and then recognize common asthma and COPD medications, and then talk about our naming patterns that we can see here. So these are the different classes we're going to talk about today: seizures, sleep medications, and then when we talk about inhalers, there's kind of two different types. There's rescue inhalers when you're actually short of breath in an asthma attack, for example. And then we have maintenance or controller inhalers. There are several anticonvulsants here, and you do not need to understand the detailed mechanisms of these. Just understand that most of them work by turning down abnormal electrical activity in the brain. Seizures are related to irregular electrical signals. That's a lot of the stuff that's going on in your brain there. So here are our medications. I'll just say the names for you: carbamazepine or Tegretol, oxcarbazepine or Trileptal, Divalproex or Depakote. Now, you might also see this listed other places as valproic acid or valproate. They're all exactly the same thing. There are also a couple of other brand names like Depakine that you'll see for Depakote, but they're different dosage forms there. Lamotrigine or Lamictal, levetiracetam or Keppra. That is one of our most commonly mispronounced medications. So you'll hear a lot of people just say generic Keppra, but it's levetiracetam. Next, we have lacosamide or Vimpat, phenytoin or Dilantin, topiramate or Topamax, clobazam or Onfi. You might also hear that pronounced clobazam. Phenobarbital or luminol. People will shorten that a lot to phenobarb. So if you hear them say phenobarb, that's what they're talking about. Then we have gabapentin or Neurontin and pregabalin or Lyrica. And gabapentin and pregabalin, those also could belong in the musculoskeletal because, well, it's technically not musculoskeletal, but we use those for nerve pain. So when we think about pain medications, those can belong there as well. So, while each of the anticonvulsants work a little bit differently, the broad goal is to reduce that excessive electrical signaling to help prevent seizures. Everyone has a seizure threshold, and after a certain point, then you trigger a seizure. So, what these drugs like to do is stabilize these membranes to raise the seizure threshold to prevent a seizure from occurring. A lot of times these are related to sodium channels. It's a lot of related to ion channels in the brain, and that is how we prevent those seizures. You will learn much more about this once we get together later. Now, all of these medications can be used for seizures, but we do use them for other things. Like I mentioned before, gabapentin and pregabalin are used very commonly for neuropathic pain, whether the source of that is shingles. So, shingles can be very painful and is a nerve related pain, or diabetic neuropathy, patients who have uncontrolled diabetes for an extended period of time will get nerve damage, and it is painful. It can be like pins and needles, or it can be painful. So we would use it for that as well. In bipolar disorder, there are several anticonvulsants that we tend to add on to other medications uh, to to prevent manic episodes. So we call those mood stabilizers. And then also, not all of them, but a few of these we can also use to prevent migraine headaches. Specifically, topiramate and valproic acid are the two that we use for migraine prevention. Next, we have our sleep medications that we commonly prescribe for insomnia. These first three, esopiclone or Lunesta, zolpidem or Ambien, and Zaloplan or Sonata, are considered non-benzodiazepine hypnotics. We also may refer to them as Z drugs because they all have Z's in them. The Ramelteon or Rosarim, that is in a different class itself. It is a melatonin receptor antagonist. So instead of taking more melatonin, it causes your body to get more use out of the melatonin that it already produces. So there are two different classes here in these sleep medications. Next, we have our respiratory medications, and there are several more than are on this list that you will learn eventually. But for now, our main categories are our short acting beta 2 agonists. That's a SABA. You'll hear them referred to as SABAs, short acting beta agonist. Then we have our long acting beta agonists or LABAs. Then we have our anticholinergics, and we will talk more about cholinergics and anticholinergics in the fall. But another name for those would be muscarinic antagonists, and we use long-acting muscarinic antagonists or LAMAs. Our next class is inhaled corticosteroids or ICS. So you might hear someone refer to an ICS LABA. That is a common combination inhaler that we would use to manage asthma or COPD. So first we have our two short-acting bronchodilators or short-acting beta-2 agonists. Their job is to bronchodilate. It opens up or dilates our bronchioles, which improves breathing. These work very quickly. It's the type of thing some people would call this their puffer or their rescue medication or their rescue inhaler. It's rapid relief. So we have albuterol, which actually has three different brand names, and many pharmacies have all three because insurance likes to pay for different ones. But it's albuterol, may be considered ProAir, Proventil, or Ventolin HFA. And then our other one is levalbuterol, and the brand name for that is Zopanex. And you'll learn more about the difference between those two later on. Then we have our maintenance inhalers. These are not to be used in an asthma attack. They don't work quickly enough. These are the type of medications that you would use once a day or twice a day to hopefully prevent the number of times you would need a rescue inhaler. So we have our long-acting muscarinic antagonist, our LAMA, or our anticholinergic is tiotropium or Spiriva. And then our inhaled corticosteroids or ICS, we have budesonide or Pulmicort and fluticasone or Flovent. Now, it's worth noting that fluticasone is also available in a nasal inhaler, that's Flonase, but it is the same drug, but it works obviously for different reasons. So Flovent and Flonase are both fluticasone, but with different purposes. These are the combinations on our drug list. There are plenty more, but these are the only ones you'll need to know for now. We have budesonide formoterol is Symbicort, and it's an ICS LABA. Now, I'm not going to tell you that. Never mind. And then fluticasone and salmeterol is Advair. And again, fluticasone is an inhaled corticosteroid, and then salmeterol is a LABA or long-acting beta agonist. Then we have ipratropium and albuterol, which is Combivent or Duoneb, which is a LAMA or a long-acting muscarinic antagonist and a long-acting beta agonist. And then we have our triple combo, which is fluticasone, umeclidinium, and vilanterol. And that is an ICS LAMA LABA. Our other respiratory meds on our list are benzonatate or Tessalon pearls. Those are for cough. They work in the stretch receptors of the lungs to basically, it's almost like a little muscle relaxer for your cough reflex. It's not exactly what is happening, but that's how I like to think about it. You have to be careful with these because if you accidentally chew them, they're little capsules and they roll around. But if you accidentally chew one and you swallow it, it can numb your throat. You have to be careful with those. And then the other one, varenicline or Chantix, is a smoking cessation agent. So it is an oral medication that we use to help people quit smoking. Then we have propofol, which is unique. It is an IV-only drug. The brand name for that is Diprivan. It's not used for treating seizures or respiratory disease. It is a medication that we use for general anesthesia or for procedural sedation. So this knocks you out. This is something that we use only in the hospital, not an outpatient medication, but you will see it a lot in the hospital. So, as you're studying this week, you can organize the medications by indication, seizures, sleep, and breathing. So, try to keep in mind which of the medications work for which disorder. And again, using Fluent this week, we do have a custom deck with all of these medications in it. Focus on your pronunciation. Saying them out loud helps with muscle memory in your mouth to make it easier to say. And if you say it right, you're more likely to spell it right because spelling is going to be important. And if anybody's going to be able to spell it right, it needs to be the pharmacist, right? Then we need to know our brand and generic medications. We need to know which medications make up our combo medications, and then know which class these medications fall under, which is an ICS, which is a SABA, which is a LAMA, and then our naming patterns, just to keep them all straight. So, as we're continuing to build our medication vocabulary, we've learned a couple of new therapeutic families. And even though the diseases are different, the way we learn them has not changed. Organize your medications into classes, understand their broad purpose. If there are naming patterns, you need to recognize those, and then reinforce all of this knowledge in Fluent. You really need to be spending time there, just spending time with it every day. It's that layered learning and spaced repetition, and it becomes easier and easier as you go forward. Pharmacy school is a lot. There's a ton of information that you will be responsible for, and trying to cram it or even trying to memorize by looking at it over and over again, that's only one tiny little pathway in your brain. We need to be utilizing multiple pathways, learning it through multiple choice, learning it through spelling, learning it through speaking. Every time you do it a different way makes it a little bit stronger in your brain. Try to explain these to other people. That's another way. By teaching other people, it will help you learn it better. But until then, keep working, and I'll see you next week when we talk about infectious disease medications.